everybody, and welcome to today's episode of Attachment Theory in Action podcast. I am excited to welcome Dr. Krista Jordan to the podcast today. Dr. Jordan is a clinical psychologist who received her PhD in clinical psychology from UT Southwestern Medical Center at Dallas in 1996. Her training included children and adults and focused on the psychodynamic theory in treatment. She went on to establish a private practice in Austin, Texas in 1998 and has been treating clients through individual and couples therapy for the past 26 years. Dr. Jordan trained with Dr. Stan Tatkin, the originator of the psychobiological approach to couples therapy from 2008 until 2022, and is a certified PACT therapist. Dr. Jordan was also appointed to the research faculty at the PACT Institute in 2023 and is the principal investigator of the first outcome study being conducted on PACT. She is passionate about treating individuals and couples from an attachment and interpersonal neurobiology approach, as well as contributing to research in the field. Throughout her career, she has applied these interests in a variety of contexts, including training postdoctoral residents, designing and running outcome studies for various treatment programs, and teaching high school undergraduate and graduate students. In 2024, Dr. Jordan became certified to administer the Adult Attachment Projective and continues to train with Dr. Carol George. In her free time, Dr. Jordan enjoys hanging out with her husband, Russell, of 26 years, and their 2 children. She also volunteers with the Blanton Museum and acts as a foster dog mom for Austin Pets Alive and Lovable. Well, welcome, Krista, to the Attachment Theory in Action podcast. I am so thankful that you have been able to join me today. You are in Austin, Texas, and I hope that you have sunshine. We are in the Midwest, and the sun is trying to get out. But I'm so excited for our conversation today. Just welcome.
Thank you. I'm excited to be here.
I always start my podcast with some of the same questions. We know that everything is all about early experiences, at least in our field. That's our perspective. And so I'm curious. Tell us a little bit about kind of what you do currently, and then is there anything that you feel in your early life experiences led you down this path and led you to where you are today?
Yeah, absolutely. So currently I have a private practice in Austin, Texas, and I see individuals and couples, although I see more couples than individuals. And I also train postdoctoral residents in individual and couples therapy from an attachment perspective. So I'm training people, and I'm also seeing my own clients, and I'm on faculty at the PACT Institute. I'm the principal investigator on an outcome study that we are doing right now, exploring the outcome of PACT therapy, which is a style of couples therapy that I practice.
Okay. And so do you feel that there's anything from your early life experiences that led you into this field of working with couples and attachment? Yeah.
Oh, for sure. I like a lot of people, I'm a child of divorced parents. And so my dad left when I was 8. And that was really tough on me. It's very close to him. I think it's tough on all kids. And so I had a depression at that age, and that kind of started a pattern of depressions for me that I struggled with for many years. And when I read John Bowlby's work in graduate school, especially his volume on loss, it was kind of like the light bulb went off of, okay, right. I did have a big loss in childhood, and that did create a real sensitivity around loss. And I noticed that once I saw it, I couldn't unsee it. You know how that works. And I started seeing like, oh, this is why I've made certain choices in my life or not made certain choices. I think I have to be careful. I have a real aversion to loss that I do think tracks back to that early loss in childhood. And so I could just see that pattern playing forward in my life, that I would stay in situations longer than really might be optimal because I just didn't want to have to deal with another loss because that early loss had been so painful. And so it fit perfectly with attachment theory when I read, attachment theory, and I thought, oh yeah, this makes a lot of sense. I'm an example of this. So it was a very comfortable theory for me to practice from because it fits me on a personal level.
Just just out of curiosity, was there a point in your kind of early learning that led you to attachment theory? Because what I'm thinking about is how many people out there would value from this knowledge, but
Mhm.
many people don't know about it. You know, they don't know about attachment theory. They don't know about unless you go into therapy. So was there anything before you kind of went down that clinical route that you were just like, oh, I just need to find out more about this? Or did it fall into your lap? How did that come about?
Well, I started down the clinical route pretty early.
Okay.
I started volunteering on a mental health hotline when I was 15. And so at that point, I knew that I wanted to pursue a doctorate in clinical psychology. So prior to 15, no, I wasn't aware of anything in the attachment theory world. But as soon as I, started taking courses in psychology, I was being exposed to it, and it made a lot of sense to me. And then I didn't apply it to couples until I met Stan Tatkin around 2008. And when he exposed me to his model, which relies a lot on attachment theory, I saw how it could be applied to couples, which is what I do today.
Mhm. Okay. Um, Before we talk more about what you do currently, something that you said really kind of pricked my ears. This idea that, oh, I did experience a loss, and that's what's leading to some of these behaviors. And I wrote down the word normalizing. I just tell me what that means to you.
Yeah, well, I think it was very validating to realize that when you experience a loss, especially in childhood, where you're not a fully formed person yet, so you don't have all of these great resources to bring to bear, right? You don't have a fully developed brain. You don't have any wisdom from having lived on the planet for a number of decades. So those early losses, I think, are harder. And so it's very validating the idea that Bowlby put forth that this could change something about your trajectory for the long term. And so instead of maybe like thinking, being angry with myself, being frustrated with myself about some of the choices I was making or not making, it allowed me to be more compassionate with myself and realize, oh, this started a long time ago. And so, yeah, I think it created more self compassion to realize the impact of those early experiences.
Well, and I think that also it highlights that there are different types of losses as well.
Absolutely.
I think for the layperson, when you think about a trauma or a loss, you go to death. I mean,
Yeah,
that's what anyone goes to.
right.
Um, but really, there are so many other possibilities for loss, and you talked about divorce. And I think about many children who are in the foster care system, for example, how many losses they might experience when they have to move homes or change placements. And then I also think about the loss of maybe a sense of self. So even that internal loss of what does this really mean about who I am as a person, and how that within that relationship, that adult or caregiver viewed me and made me feel about myself.
Mhm. No, I completely agree. I think loss, you can really expand loss in a way that helps you so much clinically. When I'm interviewing new clients, I ask about loss experiences, and sometimes people will say, oh, no, I didn't have any losses growing up. So then I give them some examples. I say, well, did you ever move? Oh, yeah,
Mm,
I did move. Oh, okay. And how was that for you? Or did you ever lose a friend? Maybe a friend moved away.
mm,
Did you ever lose a pet? There are different ways that we can experience loss. And you're absolutely right. People tend to think of it only as death. But I think anytime you have a major emotional investment in something and then it goes away, that's a loss, right?
I love that way of putting it. When you have a major emotional investment in something, um, yeah, and you know, young children, their entire emotional investment really is wrapped around their caregivers. So that's a great way of putting it, Krista. I really like that. Um, Something else when you were talking, I was thinking about, so at Chaddock, the work that we do is we have our treatment model, and it's the developmental trauma and attachment program treatment model. And we are very specific about this idea that, you cannot really look at attachment without also looking or potentially looking for any kind of trauma that takes place, because they are so closely intertwined. If trauma happens, is it impacting the attachment relationship, or
Right.
is the attachment relationship the source of the trauma? And there's so many complexities there. And I think I think that there's a movement towards and more of an acceptance of those two things being connected.
Mhm.
But I think many people still fall into those fields of it's either one or the other, and it can't take place together, which I feel like makes our life hard, because when we're trying to help new caregivers, whether that be a foster parent or a teacher or even a clinician in some form, you're a caregiver when that
Mhm.
child is in your office. Understand the importance of their relationship with that young person, even if they weren't the source of the trauma. So I think it's so important to think about those two things connected together. I don't know, maybe do you see that come into play in your work?
Well, absolutely. I mean, the way that I think of trauma is that it creates disruptions in development because it's something that overwhelms the system's ability to cope. And if you can't cope with what's happening, you can't integrate it, which means, from my vantage point, now your development is going to be altered. And it might be altered in a small way that's recoverable, or it might be altered in a big way that leaves sort of a permanent mark. But that's how I think of trauma, is that it's a disruption in development. And so if it's happening at a time when our attachment system is being developed, the first 13 years of life, and especially in the first three, then that trauma is going to impact that development, right?
Mhm.
Because that's really where the resources are going, is to create that attachment system. And then if there's a trauma during that phase, that's going to impact the development of that system.
Mhm. Mhm. So let's dive into this a little bit more, because this kind of leads into, some of the things that we talked about in preparation for this interview, different attachment styles. And I am so keen for you to share some of your thoughts and ideas around the fact that it is not necessarily just trauma that causes a disorganized attachment style. So I'm going to let you go for it. Share some of your thoughts and ideas before I jump in and take over.
Okay, sure. Well, originally my exposure to the disorganized style was through my training with Stan Tatkin, and he had been involved in infant research. So he was giving examples of parents who put their fingers in their babies' mouths or hiss at them. And so it seemed pretty extreme. And that was just sort of my very cursory understanding of disorganization, is this is what happens when there's severe trauma, severe abuse.
Mhm.
And certainly that is a way to get to disorganization. That's the most common pathway to disorganization, would be abuse or neglect. But in my reading about attachment, I came across some studies. I think it's Maine and Hess did one, and I think Carol George did another, where they were looking at low risk middle class samples. So these are samples where we were not expecting to find disorganization, and they still found it. And they found it ranging from 15 to 30%. And that was like a big wake up call for me, because I
Mhm.
thought, oh, okay. So if a client comes in your office and they haven't been abused or neglected, that's not a guarantee that they don't have disorganization. You still have to
Mhm.
be on the lookout for it. Um,
Mhm.
and that was really important to me. It also coincided with my own personal journey, because I'm a very experiential learner. So when I started doing my deep dive on attachment, which got on my radar around 2008, that's when I got really interested in it. So I started doing a lot of reading, and I wanted to figure out what my own attachment style was, because that's how I learn best. And so I tried to find somebody to give me an AAI. And I don't know if I just live in some weird Bermuda Triangle in Austin, Texas, that you can't find these people, but there wasn't anybody. And so that was frustrating, but I eventually did find an instrument called the Vorteg, which yields an attachment classification. So I went ahead and had that administered, and I came out as disorganized. And so that was very interesting to me because that flew in the face of what I had been led to believe was the route to disorganization, because I did not have any severe abuse, neglect, maltreatment. My family would not have been considered a high risk, family. And yet here I was with this classification. So I entertained the possibility that the Vorteg was wrong. So I wanted again to get the AAI done, couldn't find anybody to do it. So I ended up getting the AAP done. And the AAP also came out disorganized. And so I was like, okay. So I have this classification that has been mostly associated with a background that doesn't fit with my background. And that really got me curious. So I started just doing as much reading as I could about the disorganized style and the pathways to that style. Mostly doing me search, as they like to say, like trying to understand myself. But I was also worried that I didn't want to miss this in clients. I felt like, to be honest, it was probably missed by my therapists in the past. And especially in the couples therapy that my husband and I did, I don't think those therapists had any inkling that there was disorganization in our dyad. And I think that made those interventions less effective. So I didn't want to miss it in other people. And I found that I was an example of an unusual route. So in my reading about it, what I came to understand is that it's not all about abuse and neglect. Again, 15 to 30% of low risk samples will have disorganized kids. You can also get it. There's some research on the genetics. It's not been completely replicated at this point in time, but still there have been some studies finding differences in serotonin transport genes and dopamine genes and oxytocin genes. So maybe there's like a genetic vulnerability is kind of how I would think about it. And interestingly, there's some shared genetics between ADHD and disorganization, which is a whole nother fascinating topic. But anyway, so possibly some genetic predisposition, but then also I just really latched on to this idea that frightened faces are frightening. And this has been written about a lot, but it's always just kind of like this add-on. It's like, yeah, disorganized kids come from homes where parents are abusive or neglectful or alcoholic or drug addicted or dissociative. And then they always have this little add-on of like, or frightened. And I was like, well, what does that mean? Or frightened? That's not abuse. If I'm a mom and I'm frightened, I'm not abusing my child. So how does that work? So the way that I explain it now to patients is through evolution. I say, if,
I love, please share your monkey example. I think it's wonderful.
So what I say to my clients is, if I'm trying to help them understand how it is that they are disorganized or unresolved and they didn't have abuse, I say, well, evolution did this thing where if you got two monkeys in a tree and maybe one monkey's up high and the other monkey's down low, and the monkey that's up high sees a predator and the monkey down low can't see it because he doesn't have that vantage point. The monkey at the top of the tree is going to start shrieking and behaving. It's going to activate the fear response, right? So you're going to see this fear response. And the monkey down low is going to also have their fear response activated, even though they haven't seen the predator. Because looking at someone who is scared is scary. And so I started thinking, okay, in what circumstances might your caregiver be frightened? And it made me think of PTSD and trauma. It made me think of how if you have PTSD, you can be triggered into a fear response, even when the actual threat is not present, right?
Right.
That if the caregiver maybe has a history of trauma themselves, they could be triggered into a fear response by interacting with their child, the same way that somebody with PTSD can get triggered by something they see on Netflix, And then in that moment, that caregiver is scared. Their fear response has been activated. And then the baby's going to see that. And then that puts that baby into that fright without solution complex of disorganization, where they are now scared. The infant is now scared. And instead of being able to go to the caregiver to get comfort, they look at the caregiver, and the caregiver is the source of that fear. And so, even though this gets mentioned in the literature, I hadn't ever seen it really explained, and I hadn't seen it emphasized. And so, it made sense to me. It fit my own personal experience that both my parents came from abusive homes. We were not abused, but my hypothesis is, how do you get somebody like me who wasn't abused and ends up disorganized? My hypothesis is because my parents were abused in childhood
Mm-hmm.
and grew up in violent homes. They probably looked scared some of the time when they were parenting us. And that triggered that fear response in me, which is just that evolutionary system to keep us safe. That if somebody next to you is scared, you probably have a good reason to be scared. You better get on it and get that fight or flight response going.
Mm. There's a lot to unpack with what you just said. So much to think about from this perspective. The first thing that my mind goes to is the thought of many many foster and adoptive parents who their desire is to help and provide a safe space for children, but who maybe have their own trauma histories. And while that child in their care may already have an established attachment style, the possibility of them continuing to reinforce it because of their own experiences. And, you talked about something that the child is maybe doing that is triggering that fear response in the caregiver, I think is even more complicated when you are working with children who do have behavior challenges because of their experiences. So they have these exacerbated, more powerful behaviors. It would make sense then that kind of situation would occur. That was where my mind first went to, but then really trying to think about a family unit that is a lot more stable and a lot more consistent, much like the one that you have described, although you experienced divorce, to be able to really understand the nuances of what this might mean. We talk about epigenetics and that kind of transference, but what we're talking about here really is more of those interactions that the child and the caregiver is having.
Right. It's behavioral transmission instead of epigenetic transmission. And the thing that to me is so, I don't know, alarming is that this is, you're not going to give a kid a disorganized style if 1 out of every 200 times you look scared. But on the other hand, you don't have to look scared all the time. It's a delicate, tipping point. It doesn't necessarily take as much as one might think, is sort of what I really came to in trying to drill down on that 15 to 30%. How are they getting there? And yeah, it's behavioral. And if you go back to the original research in the strange situations, it can be subtle. It can be subtle lapses in monitoring of the parent. It can be subtle loss of sort of tone in the face stilling a little bit. And now that I am trained in how to code the AAP, if you have even one story that is unresolved, it creates it's a unresolved classification for the whole protocol, even if the rest of your stories are fine. So it is the case that it is a delicate tipping point to go from an organized style to a disorganized style. And I don't think it takes as much as we've been led to believe. I think you can get there easier than you might think.
I'm so glad that you brought that up, because I'm sitting here thinking, and being a fairly new mother myself, I have a wonderful stepdaughter, but to my own biological child, that my mind kind of goes to that fear of,
Yeah.
what am I instilling in my child? And so I appreciate you saying, no, if you have a lapse here and there, it's
Mhm.
the likelihood is that it is very small that you're going to create this, an insecure attachment style in your child. But on the other side of that, what you're saying is, what I hear you saying is that there is a very fine balance. And we're doing a lot of work right now into looking into the impact of technology and screens and that kind
Mhm.
of thing
Yeah.
on child development and relationships. And some of my thoughts are drifting there.
Yeah.
And where is that balance? If I'm a single mom who's exhausted at the end of the day, and I have to look at my phone for a while and zone out, how much damage am I doing potentially by having that kind of still face and loss of interaction with my child? Or is it okay because the rest of the day, 80% of the rest of the day, I've been nurturing and interactive and responsive to my child, and we've had these wonderful experiences together. Just raises a lot of thoughts and questions.
Yes, I know. And I'm really not a fan of technology. I think it's done more harm than good. I had a home office when my children were little, from the time my son was born until he was about 3 or 4, and my daughter's 2 years behind him. So I had infants and toddlers in the home with a home office. And I remember talking to an attachment researcher, and she said, that's not optimal, Krista, because you're there, but not there. And children
Mm,
have a hard time understanding there, but not there,
mhm,
because it's a complicated construct. It's
mhm,
not black and white. Children can think in black and white terms. They think in a very primitive way because they have primitive minds. And as we get older, we learn the shades of gray and nuance and how to hold two things together that shouldn't be together, right?
mhm,
Dialectics, like that's all much advanced cognitive functioning. So my 6-month-old baby or my 2-year-old son could not understand the mom's here but not here. And I worry that phones are the same way. I'm in the living room, my toddler's playing at my feet, I'm there, but I'm also not there.
mhm,
Because when the
mhm,
toddler glances up at me to see the delight in my eyes that I just stacked all these blocks on top of each other, they get nothing because the
mhm.
parent has got their face in the phone. Yeah, so I mean, believe me, I have kids, and I remember how hard it was. um, it was really, but we got through our kids' childhoods by the skin of our teeth. My husband and I will say it was tough, but at the same time, I am glad people are looking at the impact of this, because I do think it stresses children in a way that their systems are not designed to be stressed.
Mhm, mhm. Yeah, because if we look at it from that evolutionary perspective, for so many, many, many years, this is not something that a child's brain and body has had to react to,
Right.
and respond to. I think about kind of the naysayers in my brain as saying, well, yeah, but what about when you have to do the dishes and you're not paying attention to the child, or when you're doing this job or this chore that needs to be done? So, there's a lot. I think there's a lot that we could go into. I think we could have a whole other podcast about it. The thing that I really want to focus on, though, is your comment about that it can be very subtle. I mean, with technology, it's very obvious, these lapses in interaction, and emotional responsiveness. But really, what's so interesting but also terrifying is this idea that it can be very subtle.
Absolutely. Yes. I mean, as a parent, the more I learned about attachment, the more terrified I was that I had probably really messed up my kids. So I think that's a universal experience that I've heard from therapists is that when they start studying attachment, if they're parents, they get pretty scared. Um, yeah, we're all doing the best we can with what we've got, you know.
Hmm.
And what I would say to parents, if you think maybe in hindsight, you're not sure that you provided good enough parenting, get your kids in therapy. You know, interventions can help. We've
Hmm.
got plenty of research to show that we can shift kids and adults from a disorganized style into an organized style.
Hmm.
So, you know, if you're overwhelmed as a parent, you're not being adequately supported, our culture doesn't do a great job of supporting families, and you think you're not giving good enough parenting, you can have your kid assessed and you can get them intervention.
Hmm. Well, and I think you can get yourself intervention too.
Yeah,
I think, we, one of the things that we really try to promote through our therapy work is that it is, the client is the relationship.
mhm,
And so, yes, it is one thing to get your child into therapy, but really those repairs need to take place within the relationship. And part of that repair is, yeah, there were lapses in my care,
right,
and sometimes they were big and sometimes they were really small, and I didn't even know I was doing it.
right,
I I work with a lot of educators, and one of the things that I try to highlight to them, and this is kind of a reiteration of what you've said, Krista, but that it's not always those big abuse cases or neglect cases that is causing this developmental trauma, this relational trauma. It's you've got a single parent who's working two jobs, who's living in a community where there's violence, who is exhausted by the end of the day and can only give the best that they can.
right,
But that buildup of all of those variables is enough to tip that balance that you're talking about.
right,
And then we have children coming to school who don't trust the adults around them. They don't know that you're going to keep them safe. They don't know that you can be predictable and consistent, and respond to their needs. And so I'm just glad that you've brought this to the attention of this conversation, because it's definitely warranted, and I think many more adults need understanding that it is nuanced, it is more subtle, it's not always those big in your face cases that you might come across.
right. You know, once I got trained to do the adult attachment projective, I just started administering it to the clients I had on my caseload at the time. And 100% of my clients were disorganized.
Wow.
And I'm not even that's not even a middle class sample. My clients are upper middle class. They all have advanced degrees. They are all functioning really well by American standards in terms of just achieving and having stable marriages and, groups of friends and, to the outside eye, nothing to see here. And yet they were all unresolved. So I do think that there are more people walking around with unresolved attachment than you might think. And, I think missing that as a clinician, it's just going to diminish the impact you can have on someone because attachment is so foundational. But once you know it's there, then you can start working on it. Oh, and
Hmm.
I did want to say too that the PACT model, although it was originally designed for couples, works for all dyads. So I've done some really cool attachment work with different dyads. I've worked with siblings, adults who were siblings who came to me to work on their relationship. And I've worked with parents and children and mostly older teens, 17, 18, 19, with a parent. And you're absolutely right. What the kids often end up saying is they're not talking about any big T trauma. They're talking about more chronic feelings of misattunement from the parent.
Mm.
But if you get them in the therapy space, you can work on that and facilitate some really beautiful repairs.
So a couple of things I wanted to focus on that I want our listeners to hear about. let's talk a little bit more about your work with couples and when that disorganized style shows up and kind of maybe, I don't know, some of the feelings that come up within couples or within individuals when they learn about that, and then maybe some of the work that you do to help move towards more of a resolved attachment style.
Sure. Uh, are you asking when I give people feedback and tell them that they're unresolved, how do they feel?
Well, yes, but also what does that understanding help? How does that understanding help them within that relationship?
Oh gosh, so much. Um, it's one of the reasons I really love the PACT approach is because as a part of the PACT approach, we're giving people feedback on what we see them doing from an attachment perspective. And it's just such a non-punitive way to frame it that, hey, these behaviors were instilled probably before you were even 3 or 4 years old. We can reliably, type attachment by 18 months. So right there, it is just such a great weight off their shoulders because you're telling them these patterns, your expectations of relationships, expectations of how other people are going to show up, which then creates the expectation of how you're going to show up. That all happened before you even had language. You
Mhm.
weren't even speaking in full sentences when this was going on. So you didn't choose this. It's not your fault. And yet it is driving the bus, right? It is the thing that is defining your relationships. So on the one hand, I think knowing your attachment style can be very shame reducing because of the fact that this all happens at such a young age. It's not your fault. And it can be empowering too, because now we can predict where you're going to have trouble. And then we can show you the more adaptive response, right? So if I'm working with an avoidant, the more adaptive response is to get into feelings instead of shut down feelings. And that means getting into their own feelings and getting into the feelings of their partner or their child, right? If it's a preoccupied person, it's to get out of your feelings more often and not ruminate in them, right? If it's a disorganized person, it's to establish safety because that's the primary concern with this disorganized style is there's no sense of safety. And when you don't have a sense of safety, you're not going to be able to operate as your best self because that threat response pushes you down in the brain into earlier areas in our evolution. It pushes you into that midbrain. So now you're in a limbic state and you're just not going to be your best self. So I do think that finding out what your attachment style is can help you make sense of yourself, create that cohesive narrative, which we know is so important in therapy, address any sort of feelings of shame around thinking that you maybe somehow are doing this to yourself, realizing
Mhm.
this was passed down from your caregivers. It wasn't anything you chose. Also, in couples, it's super helpful for them to know each other's styles. And I always say, oh, he was like this before you met him, or she was like this before you met her. In fact, she's been like this since she was 18 months old. So this isn't anybody's fault, right? And she would be like this with anybody, no matter who she married, she would have expressed this, right? You too, no matter who you married, you would have expressed this because this is the template that you created. These are your expectations about relationships. Now they can be changed, but the default is there, right? So I find people are very open to it. I also do, if I'm going to give someone the feedback that they're unresolved, I always do share with them that I'm unresolved.
Mhm.
Because I think that's helpful for them to see, oh, I'm a functioning person, I have a job and a marriage, and I'm reasonably well adjusted after many years of therapy. So I tell them I'm a good person to get the feedback from because I have the same style. And so this
Mhm.
is not some sort of death sentence. It doesn't mean that you can't have a good life. It just means you have a certain set of issues to work on.
Well, and that kind of leads me to the other point that I was wanting to touch on is, um, and I've written down in my notes, I put disorganized. Is there hope? Because, yeah, and we discussed this a little bit before we started recording, but a disorganized attachment style is often associated with many complex mental health concerns,
Yep.
many challenging and often violent behaviors.
Mhm.
There are a lot of negative associations with a
Right.
disorganized attachment style. And so um, I, yeah, maybe I'm gonna let you share your thoughts. What are your thoughts? Is there hope? I mean, I believe there probably is. You're, as you said, you are functioning. You're mostly functioning, successful adult. Yeah, what are your thoughts?
Well, there definitely is hope. But I want to point out first that disorganization is like almost any other thing label you can put on a human being, which means that it's on a spectrum, right?
Mhm.
You can be slightly extroverted or extremely extroverted, right?
Right.
You can be slightly shy or horrifically shy. You can also be barely qualifying as unresolved or massively qualifying as unresolved. Um, and as you could imagine, I think the people at the higher functioning end of that continuum who maybe have less evidence of disorganization, that's where there's the highest potential. But I do think that even I've certainly done therapy work with people with very traumatic backgrounds and seen tremendous growth. So I think change is possible at every level, for sure. It's just that if you're at sort of the deeper end of the continuum where there's really a lot more trauma, it's going to take longer, right? And we just need to set that expectation. This is not something you can fix in 6 sessions of psychotherapy, you know.
Mhm.
In my opinion, if you have severe trauma, you're probably going to be my client for 5 or 6 or 7 years. Now, at the end of that, you should have an organized style and be functioning a lot better, but it's long-term work. Um,
And so much determines on who else is in that person's life as well. You know, again, I go back to educators because I do so much work with them, but just in the last few weeks of trainings, having conversations with them who they feel very helpless because they don't see a change in that young person's behavior, despite them showing up for them the same way every single day. And I think that you've highlighted that a very important point, that it takes years of new experiences, years of reorganizing, rewiring the brain, and the body when trauma is involved as well, that before we can really start to see that success. So while there is hope, it can sometimes be a long process.
Yeah, I want to say 2 things about that. I'll with the hope one, which is that David Elliott, and Carol George and one other person whose name is escaping me, I think there was only one other person, did a study on folks with PTSD in France. Their sample size, I think, was around 17. 12 of those people had disorganized attachment. They gave them all AAPs. And then they used David Elliott's idealized parent protocol therapy over 5 weeks. Five. And 4 of the 12 disorganized people changed classifications. Two,
Wow.
two went from disorganized to secure, one went from disorganized to avoidant, and one went from disorganized to preoccupied. But still, even though they're going to an insecure style, they are now an organized style, right? So it's still a step up. And that's
Mhm.
just with 5 weeks. So I absolutely think with the right kind of therapy, you can move people from this category into a secure category. So the other thing I'll say is that I like to rescue dogs, and rescuing dogs has taught me so much about human behavior. And the last dog that I rescued, she's still with us, showed me how long it takes to recover from trauma. Because when we got her, she'd clearly been abused. And getting a collar on her to take her for a walk was a major fight, because you would hold up the collar and she would duck, and then you'd hold up the collar and she would duck. It was clear that she did not want to have a collar put on her. And I'm guessing, probably having a collar around her neck had led to something traumatic. It took 3 years for me to remove that conditioned response.
Mm.
3 years of walking that dog twice a day, every day, until her nervous system could update its model and understand that that collar was no longer a threat. And that's a dog's brain, which is not very complicated compared.
Mm-hmm.
So if it takes a dog 3 years to figure that out, how long do you think it's going to take a human with all of our complexity? So I just think people need to really understand you have to be incredibly patient if there's been trauma, because those responses are so deeply ingrained. And not take it personally. My dog was ducking because I'm a bad person. My dog was ducking because somebody else had been a bad person.
Right, right. And isn't it's quite, I don't want to use the word funny. I take that back. It's not, it's interesting that us as humans, we could take a behavior like that from the dog and not take it personally, but from another human, we do take it personally. And then it gets, it gets in the way, but you're completely right. Patients are not taking things personally. But I do want to say it's so much more complex than that, obviously. We know that it's so much harder than just saying, well, don't take it personally, there's so many layers to it. But
Right, but understanding your partner's attachment style actually does help you not take it personally. Once I figured out that my husband was likely avoidant, it changed the way that I contextualized his behavior. If he was in the garage for 3 hours working on a project, I used to think, well, he's avoiding me because he doesn't love me anymore. And then once I realized he was avoidant, I thought, oh, he's just in there auto-regulating because he's forgotten that he's in a relationship temporarily. Right? And it had nothing to do with me, right?
Right.
So I do think it is easier to not take things personally if you have some sort of a framework, so that otherwise you're going to self-attribute. That's just a very human thing. But if we have something else to attribute it to other than the self, I do think it's helpful.
And I think as therapists and clinicians, we have the luxury to, we practice these things in our training, in our learning, and we do have that luxury of that understanding. And I loved your comment earlier about, we really should be, I'm going to mess it up. This isn't exactly how you said it, but the idea of we should be doing it, finding out what people's attachment styles are within therapy work, because they are so vital and also so helpful in their healing journey.
Yes, absolutely.
So
along that, oh, sorry, go ahead.
No, go ahead.
Well, I was just going to say there's a funny thing it's amusing to me, been happening in my individual therapies lately, which is I've got people who are single. And of course, since they work with me, they know all about attachment. So then in their dating life, they'll go out on a date and then they'll come back and lay out all the behaviors to me. And they'll say, okay, do we think this one's secure? And they've actually had several clients be able to change their dating patterns because they are now aware of attachment, and they can see signs that a person might be avoidant, or they can see signs that a person might be preoccupied. And it's also helping them value secure behaviors more than they did before. Secure behaviors can seem kind of boring, or it can if you're not used to it. And so they're able to say, wow, this person really seems to have a lot of security. And even though they're not as sparkly as this other person that I saw in the dating profile, I'm really going to value that security because I know that's going to be good in the long run. So it's had kind of a fun impact on my clients' dating lives.
That makes me think about something that could be quite interesting. And I don't know that we have the time to go into it today, but I'm thinking about when you're talking about the dating world and how sometimes those insecure tendencies or traits, are they more attractive to somebody when you're single? How do those things stand out? You mentioned sometimes those secure traits can be kind of boring. Yeah. And so it's got me thinking, about how does attachment style show up in the dating world? And are we as individuals more attracted to insecure traits if we're young and single, or, I don't know. What are your thoughts?
Well, what I've noticed is that if you have an insecure style, you're most likely going to be attracted to people with an insecure style.
Mhm.
Um, or let me put it this way, if you do not have security, you will most likely be attracted to other people who do not have security. Like finds like. So yeah, I rarely see someone with that does not have a secure style be attracted to someone who's secure. And they can make up all kinds of narratives about it. But what I think is going on as a therapist is it just doesn't fit their paradigm.
Mhm.
They don't understand secure people. They're playing by different rules and it's confusing to them. So I think they're
Mhm.
just more comfortable with people who are not secure because it's more familiar.
Mhm.
We mate partially by familiarity.
Well, and that aligns with what we know about the children that we work with too. That when when they come into our school or our residential settings, it's uncomfortable for many of them because we are trying to provide a place of relational security,
Right.
and we see those increases in behaviors because their body and their brain is saying, nope, this is abnormal, this doesn't
Right.
feel right,
Yep.
this doesn't match what's going on inside here.
Right.
And so I need to push against it with everything. But it's very interesting for me personally to think about it from that adult relationship perspective. And um it just highlights for me again that attachment is part of so many pieces of our lives that we
Mhm.
aren't even some of us don't even know about.
Right. Absolutely. That's why I love working with it.
Well, Krista, I just want to say thank you so much. It has been a pleasure talking to you. I always say this at the end of my podcast, but most definitely my wheels are turning. My brain is just thinking about all of the fantastic ideas that you've brought to this conversation. I will definitely be looking into the frightened faces are frightening concept in more depth. I had some awareness of it from working with our children and how we present ourselves, but just there's a whole other depth to that you've brought to my awareness, and would love to look into that more. So thank you so much for joining us, and hopefully we'll have you on again in the future.
Yeah, that sounds great. Thank you for the opportunity.